Hello, I'm so excited to talk to you about the mind-body connection and how stress can amplify pain. I do not have any disclosures, and this is what we're going to talk about. We're going to cover these topics about the mind-body connection, stress and the immune system, central sensitization, the pain and stress vicious cycle, an integrative approach, and some conclusions. So EDS, HSD, and hereditary disorders of connective tissue are real conditions that are multidimensional and complex. The biologic basis of the mind-body connection in these conditions involves the brain, the nerves, and the immune system that are communicating constantly, which can influence symptoms and recovery. And there's some very specific aggravating factors. We know that there's a lot of stigma, unfortunately, surrounding these conditions right now, a lot of misunderstanding still. And there are doctors that are labeling these as TikTok diseases. But hopefully we're going to make progress here. But people, as we know, suffer for many, many years without a diagnosis, which creates its own set of problems. When you have that amount of uncertainty, that can be very, very frustrating, very scary, and can definitely change how your mind and body are feeling and interacting. We also know that this diagnostic odyssey creates a tremendous amount of stress, and many patients report clinician-associated traumatization. The good thing is we know that there is neuroplasticity, even as adults. We used to think that only children had neuroplasticity, but we can use this to our advantage. When we have stress for long periods of time, that can impair neuroplasticity, but that doesn't mean that it's impossible to get some of that back. Excessive stress does negatively impact all of our symptoms, our problems, and our organs. Coping with stress effectively is key, although it can be hard to figure out how to cope with stress effectively. But this is very important because, of course, not all stress can be removed. We talked about this recently in my podcast. We've discussed both clinician traumatization with Dr. Colin Halverson, and we also have discussed, what wires together, what fires together, wires together. I had a session with a psychiatrist, Dr. Shimi Kang, and we talked about that quite a bit. So what about acute stress on the nervous system? Acute stress causes the sympathetic nervous system to go into the fight, flight, freeze, or fawn mode. So you've probably heard of this already. And this is very helpful short term. If you have been in a car accident or you have an animal chasing after you and you need to run away, you don't need your digestion to be going. You need to have the blood flow to the muscles so that you can run away and escape whatever stress that is. But chronic stress keeps the system on and it disrupts the hypothalamic pituitary adrenal axis. And this balance is very, very important to have in balance. And we see it out of balance in people who have dysautonomia or specifically conditions like POTS, postural orthostatic tachycardia syndrome. When your nervous system is in fight, flight, or freeze, as can often happen in POTS, the result is poor sleep, heightened vigilance, more gastrointestinal symptoms, activated mast cells, and chronic pain. We know that mast cells are very sensitive to psychologic stress. So anytime we have psychologic stress or physical stress, that will activate mast cells and cause them to degranulate and or make them more sensitive to degranulation. And these threats can lower the pain threshold, which is especially relevant in people who have EDS or HSD. And pain and stress cause a vicious cycle. Pain and stress share overlapping biologic and psychological mechanisms. Both begin as protective functions, but when they persist, they become maladaptive. Pain and stress are both recognized as global epidemics that lower the quality of our life and our functioning. Without intervention, they can become chronic, leading to major healthcare costs, lost wages, and lost productivity. These things feed into each other and create a self-reinforcing cycle. Pain causes stress, poor sleep, and problems with mood or autonomic imbalance, which can lead to more stress, and then the cycle just perpetuates. Well, what are some key drivers of this cycle? Some of them are physiological. We can have maladaptive neuroplasticity. So we can use neuroplasticity to help us and to help us get out of like cycles where we're catastrophizing, where we think that the worst is always going to happen. We can use our neuroplasticity to help us get out of those cycles, but sometimes neuroplasticity is also maladaptive. So if we've been having bad appointments, if we've been having a lot of stressful encounters, if we've been having trauma, whether it's big T trauma or little t trauma, those things can make the neuroplasticity actually be maladaptive. We can also see neuroendocrine dysfunction and chronic inflammation. We also have cognitive and behavioral factors like fear avoidance, hypervigilance, and catastrophizing. Hypervigilance is when we're, looking for every sensation in our body, and we are just on the lookout. When our sympathetic nervous system is activated, we are often in hypervigilance. There are also social and environmental factors like limited social support, socioeconomic stress, and lifestyle factors. And breaking this cycle requires a holistic strategy. It often requires a multimodal strategy involving medication, lifestyle interventions, psychologic care, etc. But greater awareness amongst healthcare professionals and other people that are in this community can definitely help improve outcomes and well-being. So we can see this stress pain spiral. So it can start with a pain flare up here, which of course is going to lead to a stress response that's completely normal. And then you're going to get most likely poor sleep and decreased mood. And then your nervous system goes on hyperarousal, which can contribute to central sensitization, or when the software of the nervous system doesn't process pain signals correctly. And that can lead to more pain and a pain flare. So this vicious cycle can be very, very tricky to break. The cycle many times can be broken, but it just requires a lot of work. So we want to think about stress, mast cells, and allergic disease, because stress increases inflammation and can worsen allergic conditions like asthma, eczema, and mast cell related disorders. We have something called corticotropin-releasing hormone, or CRH, which can activate mast cells and nerves through its main receptor. CRH is released not only in the brain, but also in tissues throughout the body. And outside the brain, the CRH prompts mast cells to release inflammatory mediators and cytokines, even though they might not fully degranulate. This makes the mast cells more sensitive, lowering their threshold to both allergic and non-allergic trigger. So what that means is that stress, causes the release of this hormone, and this hormone causes this release of inflammatory mediators, and that creates a vicious cycle. So we know that psychological stress impacts mast cells very much. And in the pattern that I was just discussing, where we have stress, we have the release of CRH. This causes mast cells to release histamine, interleukins, TNF alpha, tryptase, all kinds of other mediators, and that can sensitize neurons, and that can cause a vicious cycle here that we see that can also involve the connective tissues and the blood vessels, where we can get more release of CRH and more impact of these neurotransmitters, because the mast cells also releasing bradykinin and histamine and tryptase, and it will also affect the blood vessels and what's going on in the skin. We get these feedback loops, inflammation and pain. Again, the mast cells themselves can also release CRH, which increases their sensitivity to substance P, which is a very important pain, immune stress related chemical. Substance P and CRH reinforce each other, creating this loop that keeps the mast cells activated. And that loop drives ongoing inflammation and also heightened nerve signaling. This also causes worse allergy symptoms and mast cell type symptoms, but also increased pain, because inflammatory mediators amplify how strongly the nervous system perceives pain. Breaking these loops can help open the door to new strategies to treat both mast cell disease and chronic pain. Stress and threat learning can also amplify pain. So pain can feel like danger. Even if the pain is chronic, the brain learns to perceive pain as a threat, which turns up the body's alarm system. Stress boosts threat focus. So under stress, the brain pays extra attention to anything that might hurt. So normal signals feel extra risky. Stress hormones shape learning. Cortisol and other stress signals can make fear memories stickier and can make safety learning harder. Avoidance feels good now, but it hurts later. When we're stressed, we default to rigid, rule-setting behaviors like rigid guarding, resting, and avoiding activity. And that might help in the short term, but it definitely doesn't help in the long term. Again, stress and threat learning amplify pain with that worry and catastrophizing fueling the loop. And pain itself is a stressor. Oftentimes we get this threat generalization. So once the alarm has been set off, more and more things can trigger that alarm: touch, movement, even thoughts, until safety is relearned. So I mentioned central sensitization earlier. Let's just briefly talk about what that is. It's increased responsiveness of neurons where ordinary input can feel painful. Basically, the volume knob gets stuck on high, and we get allodynia and hyperalgesia. So things that are normally not painful are painful. And evidence is growing in chronic pain populations that this is really, really common with especially hypermobile EDS and HSD. So the key message is that sensitization is a physiologic process. It's not a character flaw. With central sensitization, we know that people often live with daily baseline pain from joint instability, fatigue, and so much more. Over time, this also builds a remarkable amount of resilience. Many people are living with a lot of pain that would sideline other people, even though they might have central sensitization where their pain signals are amplified and keeping their alarm system on high alert. So they might appear tolerant or stoic, but their nervous system is still working overtime. I want to talk a little bit about the strategy that I use for managing persistent pain in people with hypermobile EDS and HSD. This is the men's PMMS strategy that I've talked about both in this journal article, and there was a part one to this article that I co-authored with Dr. Courtney Gensimer and Victoria Daler. We want to first establish the proper diagnoses, but this is the paper, and we also talked about it on my podcast, episode 68. So what do we want to do first? I'm not going to have time to go into all the components of my algorithm, but we're going to just talk about a few key points. We want to make sure that we validate that persistent pain in connective tissue disorders is real and is common. Stress acts like a volume knob on those pain pathways, but that does not mean that it's all in your head. People with these conditions face often decades and high rates of chronic pain, dysautonomia, especially POTS, and mast cell disorders and mast cell activation syndrome. Nervous system sensitization can intensify symptoms even without new tissue injury. But there's some great news. There's some things that we can do that help. For example, vagus nerve and brain retraining. The vagus nerve is the main rest and digest nerve for the parasympathetic nervous system. And this can help activate anti-inflammatory pathways that can calm the mast cells. We know that there's often low vagal tone when people have inflammation, dysautonomia, and pain. But there are these brain retraining programs that can be very helpful for calming the limbic system, which is the emotional center of the brain. And it's tightly connected to the reptilian center of the brain, or the brain stem. Neuroplasticity practices can really strengthen and reduce threat signals. So here's some simple vagus nerve practices that you can do. I'm sure you've heard about diaphragmatic breathing. There's all kinds of different breathing strategies that can be tried. You can also use cold water, humming, chanting, singing, gargling. There's gentle movement practices like Tai Chi. Meditation is very, very powerful, as is mindfulness. Oftentimes we're kind of trying to escape what we're feeling, but if we can kind of learn to feel in the right way, that can be very helpful, and be in the moment. Things like laughter, connection, safe touch, massage, and consistent sleep routines are critical to supporting vagal tone. There are a lot of different modalities that can be tried for persistent pain related to hereditary disorders of connective tissue. And these have varying amounts of data to support them. But we want to think about the 10% rule. Just because something, gives you just 10% improvement doesn't mean we should throw it out. Maybe if we can find 4 other things that give us 10% improvement, now we have 50% improvement. So I encourage people to think about the 10% rule and look for multiple different things that are going to each give us a little bit of improvement. There's also these brain retraining modalities that can be really, really helpful. A lot of my patients love the Gupta program. They teach you a lot of different tools that you can use, and it's really, really helpful. Also, retraining the brain can be very helpful. That's through DNRS, or dynamic neural retraining systems. I've also heard great things about primal trust. So these are a few different brain retraining modalities. Of course, these ones do cost money, but they're not super expensive, especially if you consider the cost of medications, which is usually like an ongoing fee, whereas a lot of these are either one time or one fee for the year kind of a thing. So I highly recommend that you check these out. Some of those strategies that I just talked about recently are free. So you like the humming and those kind of things. So you really want to be thinking about, does my nervous system feel safe? If your nervous system does not feel safe, then it's very likely that your nervous system is contributing to the amount of pain that you are feeling. So in conclusion, pain in EDS and HSD and hereditary disorders of connective tissue is real and multifactorial. Stress biology can amplify signals. So changing stress isn't just mind over matter. It's working on your nervous system and trying to take care of your nervous system. If your pain gets worse during life stresses, it's not weakness. I was led to believe this by one of my doctors. She was like, if stress is making your pain worse, she puts her hand on my knee. You might have heard me tell the story. Oh, honey, you might have psychosomatic pain. That's not what it is. It's your biology doing what it learned to do, but we can also teach it to do something new. Since stress biology can amplify pain signals, that means we have multiple entry points to turn the volume down on this pain stress loop. Vagus nerve stimulation and brain retraining can help. There's lots of community resources. Definitely check out other resources of the Ehlers-Danlos Society. I'm really excited about this mental health summit. I know there's so many great presentations, so I'm sure you're learning a lot. And also, please check out my podcast, which is called the Bendy Bodies Podcast. You want to practice self-efficacy without self-blame. And here are some of my references. And thank you so much for your attention.